Major depressive disorder is a unipolar depressive mood disorder characterized by a persistent pattern of depressed mood most of the day, nearly every day, as indicated by either subjective report or observation made by others. Markedly diminished interest or pleasure in all or almost all activities most of the day, nearly every day, as indicated by either subjective account or observation. Significant weight loss when not dieting, or weight gain or decrease or weight or increase in appetite nearly every day. Insomnia or hypersomnia nearly every day. Psychomotor agitation, psychomotor retardation nearly every day, observable by others, not merely subjective feelings of restlessness and being slowed down. Fatigue, loss of energy nearly every day. Feelings of worthlessness or excessive or inappropriate guilt, which may be delusional, nearly every day, not merely self-reproach or guilt about being sick. Diminished ability to concentrate or indecisiveness, nearly every day, either by a subjective account or as observed by others. Recurrent thoughts of death, not just fear of dying. Recurrent suicidal ideation without a specific plan or a suicide attempt or a specific plan for committing suicide. 5 or more of these symptoms must have been present during the same 2-week period and represent change from previous functioning. At least one of the symptoms the patient must have is either depressed mood or loss of interest or loss of pleasure. The symptoms must cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. The major depressive disorder must not be attributable to the physiological effects of a substance or another medical condition. At least one major depressive episode is not better explained by a schizoaffective disorder and is not superimposed on schizophrenia, schizophreniform disorder, delusional disorder, or the specified and unspecified schizophrenia spectrum and other psychotic disorders. The patient must never had a manic episode or hypomanic episode. This diagnostic exclusion does not apply if all of the manic-like or hypomanic-like episodes are substance-induced or attributable to the physiological effects of another medical condition.